This is a level 1A fieldwork assignment reflection video. I did my fieldwork in Fairview, Tennessee at the Fairview Pediatrics OT Clinic. Question 1. Describe an occupational based goal you think you would be essential for a particular patient scenario. What treatment activities would you recommend to achieve this goal and why? I chose a post stroke patient struggling with self eating. A key goal is improving independence with eating. Activities include fine motor exercises, simulating meal prep, and practice with adaptive utensils. These directly support daily eating and functional independence. Question number 2. How do you determine whether a treatment activity is effective for a patient? Share an example or scenario where you might need to adjust an activity to better meet an occupation based goal. Effectiveness is shown by measuring outcomes like task completion or improvement of coordination. For example, if a patient struggles with utensils, switch to a larger handled tool, ensuring progress towards that goal. Question number 3. In your opinion, what makes an observation report accurate and useful? Discuss how you would handle a situation where you're unsure about a particular observation detail. Accurate reports are objective and clear. If you're unsure, note uncertainties instead of assuming. For example, a patient had difficulty with utensil grip. Discomfort level is not reported. Consider a case where a patient's progress seems inconsistent. How would you ensure your observations capture both the challenges and the improvements accurately? I would document successes and difficulties using timestamps and standardized tools to capture trends over time rather than isolated events. Question number 5. What are some ways you could show initiative in a clinical setting without overstepping boundaries? Share examples of tasks or interactions where initiative can make a positive difference. Volunteer to set up equipment, help with patient care, or ask clarifying questions. This supports staff and improves patient care without overstepping. Question 6. Discuss how showing initiative in patient care activities could enhance your learning experience and positively impact the healthcare team. Proactive engagement lets me practice skills and observe procedures while supporting the team, creating a positive learning environment. Question number 7. Think of a time when communicating with a patient, its family member, or healthcare professional might require special attention to tone, clarity, or sensitivity. How would you approach this interaction? With a cognitive impaired patient, I would use clear, concise language, remain calm, and check comprehension to ensure understanding. Question number 8. How would you handle a situation where there's a misunderstanding with a colleague? What strategies would you use to communicate professionally and resolve the issue? I would use active listening and clarifying facts and collaborate on solutions while staying professional and avoiding blame. Question number 9. Discuss a scenario where understanding a patient's cultural background might influence an approach to treatment. How would you adapt your interactions to treatment plan, or how would you adapt your interactions or treatment plan to respect cultural values? How you think this factor influences the client's occupational performance? how it may have shaped the treatment planning process, how it may have impaired or impacted the client's discharge planning. For the patient whose cultural values, family involvement include family in sessions and adjust schedule, this supports routines in discharge planning by ensuring family support. Question number 10. How can healthcare professionals develop awareness and sensitivity to ethnic and cultural differences in ways that enhance patient rapport and trust? Engage in cultural training and ask open questions and avoid assumptions, build a rapport, and improve patient adherence. Question number 11. What are some ways you can demonstrate professionalism in an interaction with both patients and staff, even in challenging and high stress situations? You can show this through punctuality, respect, congeniality, and maintain a positive attitude. Prioritize safety and teamwork under stress. Question number 12. Discuss a situation where maintaining a professional attitude might be difficult. How would you handle and ensure responsibility and professionalism are upheld? If a patient is frustrated or schedule is delayed, pause, stay calm, communicate clearly, and document objectively to maintain professionalism. Question number 13. In what ways do psychosocial factors impact patients' performance in therapy? Share an example of psychosocial factors you might encounter and how you would document it. Factors like anxiety or low motivation affect engagement. An example is if a patient appears withdrawn. Document behaviors without any assumptions to correctly mark those psychosocial factors and the impact they have on the patient. Question number 14. How can understanding a patient's psychosocial background improve the effectiveness of the treatment you provide? Discuss ways to observe and report these factors accurately. And understanding psychosocial background helps tailor, or understanding psychosocial background helps tailor interventions, observe mood, social support, and coping. Document accurately to discuss effective care. Always make sure that you are putting everything in your notes and everything in your evals, and you have everything documented to where you can efficiently give the most effective care to your patients and explain the most effective care to your patients. During your clinical experience, what social detriments of health did you observe or learn about from from your clients? Describe one example of the encounters and explain. Um, the main detriment I saw, or not the main detriment, I saw an example of a detriment that I saw at the clinic in Fairview was families had limiting insurance coverage and weren't able to be referred to specialty therapists by the OT that I was working with during the field work. Ways that she countered this detriment was by providing guidance on community resources, alternative therapy options, and programs to support the child's progress. This experience showed me financial and insurance barriers can impact a child's overall occupational performance and the importance of helping families navigate these challenges.